Hello everyone, welcome to sqadia.com, and let's start with section 1 of our lecture topic, subfertility. In this section we will go over the basic introduction of the subfertility. So when we will talk about the subfertility, first thing we should know is what is subfertility. So we will talk about that. Then what is natural conception and what are the different factors that affect the natural conception of the couple and why the natural conception failed and what are the different treatments later on to cover up this failure and to treat the subfertility. So first, what is the definition of subfertility? Most common accepted definition of subfertility is failure to conceive if someone is trying for 12 months constantly without any interruption or without any protection. So if couple fails to conceive within 12 months, they are labeled as subfertile or infertile. Incidence is 1 in 7 couples are subfertile. There is primary subfertility, someone who never been pregnant, or some male, in case of male, someone who never fathered a pregnancy. That is a primary subfertility. But secondary subfertility is once they get pregnant in case of female or in case of males if they fathered the pregnancy, but then later on there is failure to conception, that's secondary subfertility. Always the approach to treat the subfertility should be couple-centered. If there is a pregnancy with some other previous marriage with some other partner, that's different. But it should be couple-centered. If couple has problem in conception, then it should be approached in that sense. Now, the common causes of infertility, if we see, the male are 30% are causes are related to male. Similarly, 30% are female related causes. Combined male and female are 10% unexplained. No cause of infertility is known in about 25% of the cases, and there are other about 5%. So 30% female, 30% male, combined male and female are 10% unexplained causes. After all the tests done, after all the investigations, sometimes there is no cause known for infertility. So those are unexplained, no known cause for infertility. 25%, that's a big number in which no cause is known. And then about 5% are labeled under the other causes. So in this slide, we will talk about the natural conception. What's natural conception? When sperms and ova fuse together after the intercourse, that's the natural conception, and fertilization takes place. So healthy couples have 18 to 20% chance of conceiving in one cycle, and this percentage keep on increasing with the time. As they try more and more with time, the incidence keep on increasing. So within 6 months, it's about 70%. Within 12 months, it's 80%, and 24 months, it's 90%. And subfertility, as we already talked about, is failure to conceive after 12 months of trying to conceive. If the couple is trying to conceive for 12 months without any interruption or without any protection, that's labeled as infertility. So after 12 months in the normal couple, the percentage should be, or the incidence should be 80% in normal couples of natural conception. What are the some factors that affect natural conception? One is the weight is very important in females who are obese. Their hormones are affected by the weight, and their ovulation is affected, and if they do not ovulate naturally, they won't be able to conceive. So obesity or the excessive weight is very important factor affecting the natural conception. Then again, weight in excess or weight too low or too thin again is a factor that causes infertility. And being too thin, like some females, there is a disease known as anorexia nervosa, in which they really try to lose weight, and those patients usually have amenorrhea. Their menstrual cycles are not they have no regular menstrual cycles, and no menstrual cycles means there is no ovulation. So that affects the natural conception too. So being too thin is another factor that affects the conception. As the age increases, that's also a very important factor. Both in males and females, age is important. In females after 35, the number of eggs produced by the ovary decreases significantly, and that affects the conception too. Genetics play an important role. If infertility or subfertility runs in the family, there are more chances that the couple or female or male comes with the infertility or subfertility. Some household chemicals can cause subfertility too. Similarly, smoking and increased age are two very common factors leading to infertility. So smokers have lower chances to some extent. Alcohol, people who drink regularly, that decrease the fertility also. Breastfeeding gives the natural protection against conception. Female who are lactating their babies, they usually don't have the cycles, and if no cycles, there is no conception. So the time during which the females are lactating their babies, that's considered as a natural way of conception or contraception, natural contraception. Similarly, extreme exercises also affect the natural conception by again changing the weights and changing the ovulation pattern of the female. So all these factors play a very important role in the natural conception. And when the couples come to the doctor with the problem of infertility or subfertility, the first thing before starting any invasive or further diagnostic procedures, it's important to look in the basic factors that can affect the natural conception. And that's why important good history taking is very important. That gives you the idea what are the different factors that can lead to the subfertility or infertility in the couple. So that was all about the definition of subfertility, what's natural conception, and what are the different factors that affect the natural conception of the couple. Thank you for watching sqadia.com.